Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.
Good morning, everyone, and a huge welcome to this week's Health Hour. My name is Dr. Vanessa Apea, and I'm your host today. And as ever, I feel, and I'm sure you'll agree, that we have a fantastic health hour for you. Just a bit about who we are and why we're here. So we're a health hour that is a partnership of the Caribbean and African Health Network and with the Black Health Initiative, the Royal Assembly, Redeemed Christian Church of God, RAFA International, Croydon BME Forum, Enfield Caribbean Association. All these organizations have come together within a partnership to really focus on providing the information that you need to live a healthy life. And it's really great because it's for you. It's for your family members, it's for your friends, it's for your network, and it's dedicated for Black communities. And within that, we have Black doctors, Black healthcare professionals, people with lived experience, so you can learn with people that look like you. So it's great to be here. And as ever, we have a fantastic speaker. And we also are really privileged today to have someone with lived experience of what we're discussing. Before I go on, I just want to say that this session is for you, and we have an opportunity for question and answers. So please feel free to write your questions in the chat, raise your hand, and at the end, I will make every effort to make sure that we answer all your questions. And if we're unable to, then we'll organize a way to contact you separately to do that. So please engage and let us know what you need and what you'd like to learn. We are videoing, so if you, because it's so important that you can go back to this episode and reference, and as I said, share with family and friends. So if you feel uncomfortable having your video on when you're speaking, please feel free to turn it off, but just be aware that we are recording and we are sharing. I love it because we have so many people from across the UK and from across the globe. I put a disclaimer that I'm actually speaking from Ghana, so I'm going to claim one of the first international spaces of who's on the line. But we'd love it if you could share within the chat where you are, who you're with. Are you by yourself or you're watching with others? Just so that we can see the community that's on with us today. So what are we talking about today? So we are talking about something that is crucially important. And I have to say, it's crucially important for men and women, but particularly for Black women. We are talking about breast cancer, and we are talking about the importance of early detection. And we know that Black women in the UK are more likely to be diagnosed with breast cancer at an early age, which can definitely impact survival rates. So early detection is key. And we are really, really privileged to have Dr. Catherine Mbema, who is the Director of Public Health at Lewisham Council, who will be going through the importance of screening and education about breast cancer. So we are really, really excited to have you here, Dr. Mbema. And I mentioned about someone with lived experience, and we are really privileged as well to have Adiola Obadan, who is going to be sharing her experience afterwards as well. So we're definitely in for a great show. So please call your friends and family if they're not on already to join us. Dr. Mbema, over to you.
Thank you so much, Dr. Vanessa, and it's great to be here with you all this morning to share on this really important topic, as Dr. Vanessa has said. I'm Dr. Catherine Mbema. I'm a Director of Public Health, so I work all around prevention, so how we can keep people well and healthy, as healthy as possible to prevent future illness and disease. And so in terms of breast cancer, I'll be talking about why it's so important for us, in particular as Black women. So I'm going to share some slides and then I'll talk for a little while, and then I'll hand over to Adiola, who will talk about her lived experience. So let me share to the screen. Yeah. Okay, I hope I'm sharing this.
Perfect. It's on.
It's on. Lovely.
Yeah.
Thank you. I wasn't sure that. Lovely. So some of you you may have seen me talk about this before at breast cancer and Black women conference that happened last year in October during Breast Cancer Awareness Month. And it's a talk that I'm quite passionate about, because there is a lot that we can do and work together on to make sure that we prevent cancer, we detect it at an early stage to make sure that we can survive for as long as possible. So I think these are going to be moved on. There we go. Okay. So this morning, I'm going to talk to you about some statistics. So just give you an overview of breast cancer in the UK, and then talk a bit about breast cancer, in particular in Black women, and what the evidence is saying, and then what that therefore means for us as Black women in terms of what we can do to help ourselves keep as well and healthy as possible. So cancer. So unfortunately, we know that at least 1 in 2 people will develop some form of cancer during their lifetime, which is, significant, 50% of us. Common types of cancer you can see listed there. So we've got breast cancer, lung cancer, prostate cancer, and bowel cancer. And of those 4, breast cancer is the most common in the UK. So it accounts for about 50% of all new cases of cancer. And so you can already start to see the significance of breast cancer generally for the population, and I'll come on to shortly what it means for Black women as well. So again, some more key statistics. I'm a public health person, so I talk a lot about data and numbers, but you can see the number of cases of breast cancer that happen, a new case of breast cancer that happen on average every year. So over 50,000 new cases of breast cancer are diagnosed every year, which is really significant. And Dr. Vanessa did also mention, here I'm speaking about women, breast cancer women. Men can also get breast cancer. It's less common, much less common than in women. So here we're talking about tens of thousands of new cases of breast cancer in women. For men, it's more in the sort of hundreds that are diagnosed every year. So you can see that though it does happen, it's much less common in men. In terms of deaths due to breast cancer, you can see on average per year about 11,000 unfortunate deaths due to breast cancer. But then I think the next statistic is really important. You can see that 76% of those diagnosed with breast cancer survive for 10 years or more. So I just want you to hold that in your minds, that breast cancer, even with a diagnosis of breast cancer, it can be survived. So 76% of people will survive for 10 years or more after their diagnosis, which I think is significant, because that means that with detection and treatment, this is something that can be survived. So I want you to hold that in your minds, that it's something that, particularly if detected early, can be survived. And then the final statistic there, you can see about the proportion of cases that can be prevented. About 23% of breast cancer cases can be prevented. And again, I'll come on to some things that we can do every day in our lives to reduce our risk of breast cancer. So for Black women, so sorry, there's another table with numbers here. Apologies for this, but I just think it's important to understand we've got the global picture overall, what's happening with breast cancer cases. And for Black women, I want you to have a look at this table. You'll see I've highlighted or put in bold the numbers for Black women. But this table shows breast cancer that happen in women, and it's the number and percentage by ethnic group and a yearly average. And so you can see about 87% of breast cancer cases on average every year happen in whites. Generally speaking, white people. We haven't, unfortunately, the data is not broken down by subgroups underneath that. About 3% in Asian people, 1.9% in Black people, 0.5% in mixed or other multiple ethnic groups, and then other 1.3%, and then there's a proportion of not known ethnicity. So here I'm showing this because I want you to see that Black people in line, this is slightly lower than us in terms of our population. We don't get breast cancer more than other ethnic groups. However, and I'll come on to it in a subsequent slide, we do unfortunately have a higher risk of being diagnosed at a later stage of cancer than others. So we may not get it more than white people, be diagnosed more than white people, but unfortunately we are being diagnosed, or at high risk of being diagnosed at a later stage, which has some implications for survival that I talked about earlier. And I've written it here. So Black women are, however, at a higher risk of late stage breast cancer at diagnosis in comparison to other ethnic groups. So what do I mean by late stage? So here you'll see some diagrams here about when a breast cancer is detected, and so the size when it's detected, and if there are cancers in any other parts of the body at the stage of detection. That's what we talk about. That's when we talk about stage. So when you are diagnosed with breast cancer, you will have a series of tests and scans which give us information about how big the cancer is and whether it has spread beyond the breast itself. And so depending on the size, depending on where it's spread, we will assign a particular stage to the cancer at diagnosis. And there's also something that you may hear about called the grade, and that's about the type of cells that are within the cancer and what they look like under a microscope. And again, when we've looked at that, we will assign a grade to the cancer. So you will have a stage and a grade. And knowing the stage and grade will help your doctor, your oncologist, your breast cancer nurse specialist. They will then determine what type of treatment you need, depending on the size, how far it's spread, and what the cells within the cancer look like. So there are different stages. Earlier stage typically are when cancers, so that's stages 1 to 2, cancers are still largely within the breast tissue. They haven't spread. It hasn't spread very far, and that when cancer is diagnosed at those early stages, the survival is much better at those early stages. Stage 3 and 4, when the cancer it may be bigger and may have spread beyond the breast tissue itself, that is when survival is not as good. And so looking at stages again, so it's a bit more complicated table, apologies for this, but I want you to just look at the top. Actually, no, I'll have some circles that are going to come up here. So for Black African and Black Caribbean women, so this is showing you the percentage of people, or the percentage of patients with late stage disease, so that's stages 3 and 4, by ethnicity. So you can see for white British, there are about 15% of diagnosed breast cancers that are in those late stages. But see here for Black African, Black Caribbean, it is about 21%, 27%, so higher than for our white British counterparts and Chinese and Asian. So there is something happening, which means that there are more of us, or we're at higher risk of being diagnosed in those later stages. And these just talk about the ratios of that. So being above 1 means that in comparison to our white counterparts, we are at higher risk of being diagnosed at that late stage. You can see for our Chinese counterparts, they are at lower risk of being diagnosed at those late stages, and Asians slightly higher than white counterparts. So this late stage of diagnosis is something that we really have to think about, and I'll come on to some next stages and what that means for us as Black women. So what are the potential reasons for this? Why is it that we are at this higher risk of being diagnosed at those later stages or of breast cancer, or stages 3 and 4? So on this slide here, you can see there are things that are what you could call patient level factors, so things that happen at individual patient level, and then there are things within the system as well that we may also think, or we can also see maybe a reason for this, and this is from some published research. So at the patient level, it may be because of lower awareness of signs and symptoms, particularly the early signs and symptoms of breast cancer. There may be some fear, stigma, negative perceptions of healthcare associated. So it may be that because of fear of what a cancer diagnosis may mean, because of how your previous experiences of going to a GP or going to healthcare may mean that you're less likely to go to the GP when you have those signs and symptoms, or maybe less likely to also take up screening. There may be practical barriers, so difficulty getting appointments, attending appointments. And then the final one, less favourable tumour characteristics. So it may be that, as I mentioned, the type of cancer cells may be those that are likely to be more advanced at the point of diagnosis. So all of those at patient level may be, a combination of those may be the reasons why we have that higher risk of that late stage diagnosis. And also at system level, so beyond the individual, things that are happening in the wider system may also be reasons for this. So it may be that for some reason there are delays in us being referred to hospital from our GPs. When we go with a GP and we say we've noticed something happening in our breast, we may not be referred as early or quickly. In the general system, how well are we being educated about cancer? How much knowledge of available support is coming to us within our Black communities? And then the final one about training for healthcare providers. And this term cultural competence, some people I know don't like cultural competence, but how culturally, can I say, attuned are the services for us? So when we go, maybe if we have language barriers, etc., and we go to a GP, we're trying to explain something, how culturally attuned are those healthcare professionals to understand what we're saying, understand the symptoms we're experiencing, and make that referral? So I said, and there's a combination of different factors which may mean that we're being diagnosed at a later stage, or at high risk of that in comparison to those in other ethnic groups. So what does this mean for us? All of this information, all of this data, what does it mean for Black women? So this will be the final chart that I share. Sorry, you can understand I like, getting an understanding with all of the data. But here, so as I mentioned, the stages you can see at the bottom of the chart here, stage 1 and 2, typically earlier stages, which means the cancer is likely to be smaller, not spread beyond the breast. Stages 3 and 4, a bigger cancer tumor that has spread. And this, on this side of the graph, you can see the survival. So the percentage of people that survive cancer in the blue 1 year after diagnosis, in this sort of mustard color 5 years after diagnosis. And so you can see here, if you are diagnosed at stage 1 or stage 2, look at your survival. it's almost getting to the 100%. It's in the high 90s if you are diagnosed at those early stages 1 and 2. If you are diagnosed at the stage 3 and 4, look at how the survival changes. So lower survival when diagnosed at those late stages. And then for all stages, you can see taking that as an average. So, being diagnosed or high risk of being diagnosed at these late stages has implications for survival. So really, why I'm talking, in this impassioned way today, is to make sure that we can do everything that we can, both as individuals, but in the wider system, to make sure that people are being diagnosed at these early stages. You will see that survival after 1 year, after 5 years, is so high because you are diagnosed early, you are treated, you survive well into 5 years. So really, that's my message, trying to pick cancers up as early as possible at those earlier stages to make sure that survival is as high as possible. So what are the things that can be done to address this? The first, as I mentioned, some of the reasons, awareness of early signs and symptoms. So for those who are not of screening age, and I'll come on to a bit about screening in a moment, it's really important for us to get to know what is normal in our breasts. Now, I know it may sound, for those who are not used to maybe looking at your breasts in the mirror or knowing what your breast feels like, it may sound unusual. It may sound, well, Catherine, I'm not sure about, getting to my breast, but it's so important for you to know what is normal for you in your breast so that when there are any changes, and you can think about then going to seek medical advice about what those changes may mean. So I'll come on to that in a minute. So the awareness of signs and symptoms, knowing what is normal for you in your breast, is very critical, very important, particularly for those who are not yet of screening age. The next, for those who are eligible for screening, and I'll come on to the age groups that will be eligible for this, it's important to take up the offer of screening. And I think I'll come on to it, but screening helps pick up any cancer before you can even feel or see changes. And so that is so important for that picking up at that early stage that I mentioned. So when the screening invitation comes, I really want to encourage you to take up the offer of screening. If you have questions, really seek out the information that you need to make sure that you can take up that opportunity for screening. And then the final one, this is really a system level action here, but to make sure that if somebody is coming, they know what is not normal for them. It may be one of the early signs and symptoms of breast cancer that they're referred on for onward investigation very promptly. So checking your breast, this is a bit of a wordy slide here, but checking your breast, and I've added in here chest, and lots of the materials will talk about chest as well for men, as I mentioned, though much rarer male breast cancer in comparison to women. Again, it's good for people to know what is normal for you. So we've also added in chest here. So your breasts. So NHS guidelines, they talk about, NHS advice talks about checking your breasts or chest regularly, about once a month. So it can be, I'll come on to it, but if you're in the shower, when you're getting dressed, just to have a sense of what is happening with your breasts, if there are any changes, anything that looks unusual, about once a month, to make sure that you're doing that. It's really important. And it helps you know what looks and feels normal for you. Okay, so everybody's breasts are going to be different, but there'll be and so it's good for you to know what's normal for you, and then you'll be able to pick up any signs or symptoms if any changes come up. So your breasts, may and there are different times in your life, in your menstrual cycle, etc., where your breasts may look and feel different. So at different points in your menstrual cycle, you may notice some changes, which are not necessarily signs or symptoms of breast cancer. If you're breastfeeding or pregnant, again, your breasts may change and become different, and after the menopause. But those are all natural times. And I'll come on to some of the changes. But when you're checking, so that once a month, at least once a month, you're just thinking, okay, let me just have a check-in. And, I'd liken this to, on a monthly basis, we may also go to the dentist. Well, I don't know if you go to that frequent dentist, but you might go and, I don't know, you'll know what's normal for you in terms of your hair or anything else. please make it a priority to also do the same for your breasts, okay? To know what is normal for you. So you might want to check. So you might want to look in the mirror just to see what they look like. You feel each breast or side of your chest with your hand, just in a circular motion up to your collarbone, under each armpit. Just have a feel to understand what is normal. Also around the nipple, because the nipple changes can also occur with breast cancer. And you can do that if you're standing up in the shower, or if easier, lying down as well. Again, just to get to know what is normal for you, so that if there are any changes that may be signs and symptoms of breast cancer, you know what they are. And then here on the right-hand side of this slide, I've just included some images of some of the changes that may occur or may signify breast cancer. So first of all, skin changes. So this particularly, any puckering or dimpling that is not usual for you. Any unusual lumps. So we've always probably more commonly heard about breast lumps being an early sign or symptom of breast cancer. So any unusual lumps or thickening. Crusting around your, or rash or crusting around your nipple in particular. If there is a sudden unusual change in size or shape, particularly on one side. In your armpit, any unusual swellings or lumps or around your collarbone. Any unusual liquid or discharge coming from one nipple. If your nipples are what we call inverted, they're either sort of going inwards rather than outwards, or changing in direction. And the final one, breast pain, but that's pain if it's constant, it's not going away, it's there again and again and again and again and again. Again, that may be something you want to get checked out with your GP. So again, the main message here is know your breasts, know what is normal for you, so that if there are any changes of these nature, you can seek medical attention, seek medical advice. Again, it may not be breast cancer, but it's important just to seek that advice, so that if it is breast cancer, you're picking up as early as possible. Okay, so that's for everyone, actually, just checking your breasts, but particularly for those who will not be of the eligible age for screening. Okay, so breast cancer screening. Sorry, again, lots of information on this slide, but just to try and summarize, breast cancer screening, we use X-rays, we call them mammograms, to look for cancers that are too small to either see or feel. So this is really trying to get to that early detection. Before you've even had any symptoms, this X-ray can potentially pick up cancers very early. And so in the UK, anyone registered with a GP as female will be invited for screening, breast cancer screening, every 3 years, and that's between the ages of 50 and 71. So typically you'll get a letter in the post inviting you, and the invite, if you're registered with your GP, automatically comes out to you somewhere between the ages of 50 and 53. And then after that, you'll be invited every 3 years until you're 71. And so that's the invitation side of things. So that invite will come to you in the post. Typically, you have to be registered with a GP, or you should be registered with a GP, and then that invites will start automatically coming. And so you see there the age, so 50 to 71. So those below the ages, below that age, breast cancer, the reason why the screening ages are like this is because the risk of breast cancer increases with age. However, you can get it younger than the age of 50, hence me explaining a lot about the breast checking, particularly for those who are not of screening age. So what happens when you go for your mammogram? So during your breast screening, you'll have X-rays, so you have 2 for each breast. Typically, the mammograms, they're done by somebody called a mammographer, and they will be female. The mammogram itself doesn't take very long, but you'll have a whole appointment where you'll be able to, the mammographer will check your information. You'll have an opportunity to to get dressed appropriately or undressed appropriately, so that you can undertake the screening. You'll see there's an image here on the right-hand side, but basically you will have an X-ray of each breast. So your breast will be held between 2 plastic sheets, and then the x-rays will be taken. And those sheets are there just to hold the breast in place so that the x-ray can happen as best as possible. You'll be tilted to the side slightly so that the side of the breast is also x-rayed. So that's the 2 x-rays, and then you'll move on to the next breast. And there's lots of resources available. So if you've received your invite in the post, you want some more information, there are lots of resources. I've put a link here to the NHS resources, but there are many others and also some testimonials of people who've gone for screening who will just explain everything from when they are invited, when they go, when they attend screening, afterwards, etc. So do check those out if you have questions about the screening process. Sorry, I said it was the last chart. I've included another one because I just wanted to show you what's happened in the UK with breast cancer screening. So the blue line here shows what we call the coverage of breast cancer screening nationally. And the coverage means that who do we have test results from screening over a 3-year period. So how well are people taking up screening? How well are we covered? Are we covering people with this? And so we really want as high as possible. And you'll see that way back in 2013 on this chart, we had about 76% of people, so about more than 3/4 of our population, or the eligible population for screening, covered. But you'll see around the time of the pandemic, so 2020, we saw a big decline in the coverage of screening, number of people covered by, proportion of people covered by screening. And we're just recovering now. This only goes up to 2023. We're about 60%, but you can see that that's about 10% lower than 2013. So again, public health people like me see this and think, we've got a way to go to catch up to the proportion of people covered by screening. So again, another plea that when you do get that invitation for screening, please do take it up, particularly because we saw that drop over the COVID pandemic period, and you know the difficulties we had there about people attending things in person, so on and so forth. So I think we've got all got a job to do in the system, people receiving invitations to really see that coverage go up and recover. Final message, I've spoken a lot here, but the final one just about general prevention. So I've spoken about awareness of early signs and symptoms, getting to know your breast. I've talked about screening, so taking up the offer when the letter comes, the invitation comes to you. And the final one, I wouldn't be a good public health professional if I didn't just talk about general prevention. And so there are things that we can do to reduce our risk of, this is not only just for breast cancer, but so many other things for heart disease, so on and so forth, keeping a healthy weight. And so the diet and physical activity here are very important. Keeping a healthy weight reduces your risk of breast cancer, and as I mentioned, a range of other health conditions. So doing what you can do to maintain a healthy diet, doing what you can do to be physically active is just so important across the board. We're talking here today about breast cancer, but for many other things. So again, general advice, there are lots of resources, as you know, around maintaining a healthy diet, being physically active. We have guidelines about how physically active people should be, but I would say start where you are and build up from there. So if you're taking 30 minutes of walking a day, build up from there. Or okay, maybe I should have started low. Maybe if you're starting 5 minutes of walking, but try and build up as much as possible in terms of being physically active. Be conscious of what you're eating, be conscious of what you're putting in front of you. I know we talk a lot about the environments that we are living in, and it's not easy because we are bombarded with advertising and low cost, unhealthy food all around us, particularly where I am in London and Lewisham. So I know it's sometimes not easy to make those healthier choices because of the environments that we lived in, that we live within. But as far as you can, just be conscious about what you're eating. And then alcohol intake as well, again, associated with many other illnesses, but for breast cancer as well, just be conscious about the amount of alcohol that you're drinking per week. In England, we have some guidelines around alcohol intake for women. We say no more than 14 units per week, and so that's unit of alcohol. So I think 14 units is about equivalent to about 6 medium glasses of wine, something like that. So please, just monitor, be conscious of your alcohol intake as well. So those are just some general prevention messages. So I think that concludes. I will make sure that I pass on these slides to the CAN team so that you have the resources available to you as well. And I'll stop sharing there and I'll hand back to Dr. Vanessa. Thank you.
Thank you so much. And hugely informative. And many people have sent a number of questions. So definitely hitting home to people and reminding people about the importance of screening, but also just really taking care of yourself as well. So a huge thank you. And I'm going to give you a few minutes to kind of catch your breath after going through everything with us. And I'm going to kindly ask Adiola to, if you're comfortable to put on your camera, Adiola, and unmute so we can have a conversation, if that's okay. Great. Adiola, again, thank you so much for being on. And it's something that we've been introducing within the Health Hour more and more for people who have had lived experience of the topic that we are talking about, just to bring it home and to see the realities of it. And Adiola is here to share with us as someone that has survived breast cancer and wonderfully sits in those statistics that Dr. Mbema talked about in terms of survival rates. So Adiola, thank you so much for being here today.
You're welcome.
Thank you. Adiola, what I wanted to do is just to get a sense of your experiences and also how you were able to be diagnosed and a bit of your journey, if that's okay.
Okay, yeah, thank you very much. And I feel privileged to be here to share my experience with everyone that's on this call and for whoever is gonna probably watch the recording after. About my journey, so I'm among those that the Dr. Mbama talked about that. I found that during my personal checks. So I just noticed there was, I know, just like she was saying, that you need to kind of get familiar. I would say that I wouldn't say I have a bragging right to say, oh, I'm always that kind of person that would check. It just happened that I just noticed there was an abnormal feel somewhere, very tiny, very almost non-existent, but I picked it. But you know how it is that you pick something just with you just not bothered, like you didn't think it was anything. It didn't cross my mind for one that it could be that. So I mean, I moved on with my life, but I now noticed that it kept growing, right? So for every other time that I check, it was quite bigger. I'm like, okay, what's going on here? Up until that time, still, it didn't occur to me that it could be this. Maybe because, like you said, there wasn't much awareness. There hasn't been much awareness about this conversation. So I didn't think it could be that. I wouldn't say I'm not aware of breast cancer, but it's not a subject that is that is talked about frequently as such. So you wouldn't even think it could be that. So I think then I was in Nigeria when I found this out, and I tried to go check it out. But you know the way the system is when you have to long waiting period and all of those things. And I remember a particular instance, and I was about traveling to the UK then. So I'm like, let me just check this thing before leaving, just to be on a safe side, right? But I got to the hospital and I think the gen was not working, generator wasn't working, there was no light. And the doctor that was supposed to come and take my sample, I saw him just walk past me like, there's no light, there's nothing he can do. I have to come back. I'm like, I don't have this luxury of time.
Yeah.
I tried to say, okay, let me just leave it. And when I got to the UK, that was in 2022, I just went to check random after I registered with my GP closest to my house and all that. Then I decided, okay, let me just talk about this thing that's in there. Let's see what it is, And I did report it to my GP, and almost immediately, for which I'm going to give credit to the healthcare system in this country. The moment I mentioned that, I noticed a lump, even though we had just come out of COVID and it was still usually online consultation that is permissible, or that was more accessible then. But almost immediately that I mentioned that, I was given an appointment like a couple of days after to go for a physical consultation. And then the doctor checked and then referred me to the breast care team. And usually he told me that it was going to take a couple of weeks. But interestingly, it wasn't up to 2 weeks that I got the letter to come in and do my examination. So I went in, I did mammogram, and I did the screening, right? I think it was after I did the mammogram that they now consider screening was necessary. So when they screened, they noticed the lump, just like I've also noticed. Then I decided to do a biopsy of what it was. So they told me they're going to take sample and then send it to the lab to see what exactly it was. Even up to that time, I didn't really think it was anything really. Like, I'm a happy, jolly girl going about my life. I mean, and then I think I was 42 or 43 then. Yeah, going to 43, I guess. So I didn't think it was anything. So that was how they took the sample, and then I was asked to come back for my results. I think about 2 weeks after or thereabout, the results were ready, and I got a call. And the call said that, okay, that I should come for my result, but if I want to come with someone, it's okay. And if I think that I will need to record the conversation, it's equally okay. Then again, I didn't think it was anything. In my head, I'm like, what do you want to talk about that I need somebody to interpret? I didn't think about it. Maybe for once it crossed my mind, but I'm like, no, it can't be, I just waved it off, right? So I got in, and I got into the consulting room, and I got the breast care nurses came in, and they told me that unfortunately that the lump that they did biopsy on came back cancerous. It felt like I was watching African Magic. It felt like this couldn't be me.
Yeah.
And almost instantly, the only memory that I had at that instant were memories of people who didn't make it. Prior to then, in 2021, I lost a friend, not too close, but someone that I knew so well. I just got to know that she was ill. And because we had not seen throughout COVID, I thought it was just all this normal, oh, you're not feeling well. So I've not, and funny, we were chatting, we were always talking online. So only for me to hear that this lady passed, and we now got to know that she's been battling breast cancer. And I'm like, she never said anything to me, and so those memories came back to me right there in that showroom. I said, oh, Jella, so is this how you two are going to? They'll be like, oh, and we saw her yesterday and things like that. But I made a switch in my mind. And this is, I tell people that cancer is a disease of the mind. You can control anything from the station of your mind. I made a switch, and because I'm a person of faith as well, I decided to just switch and say, okay, I'm going to fight it. Even if I'm not going to win this, but I'm not going to just give in like that. So I tell them about the available treatment options and all that. And
sorry to interrupt, Adiela. Do you mind sharing what stage you were at when you were diagnosed?
It was stage 2.
Stage 2.
It was still early, but there were 2 lumps actually.
Yeah.
This DCIS, and it was triple negative, very aggressive one. So apparently the one I could feel was the big one. So there was actually another one that I couldn't feel, just like doctor was saying that sometimes it's only screening that can pick up some things, even when you can't feel them with your hands or anything. So yeah, there were 2 lumps. One was smaller than the other, but both were still within the stage 2 stage. So that's how the journey started. I was referred to the oncology department, and yeah, series of tests and everything. And so that's the background really.
Thank you. Thank you so much. You've said so many things there that I'm sure you've helped so many people on the line, and you've highlighted the importance of checking, because if you hadn't have done that, you wouldn't have even mentioned it in the conversation. But also, I'm sure many women will resonate that you feel something and you're not quite sure, and life goes on, and you kind of push it to the side because you think it's just going to be a cyst or something
Especially,
inconsequential.
especially if it doesn't come with any pain or discomfort. Mine was it was just, there was no discomfort, there was no pain, it wasn't anything. And it
Yeah,
wasn't anything that anybody could see, or, I mean,
yeah.
yeah.
Thank you so much, because again, even just seeing you and talking to you and having you share, I think it's such a powerful thing to do. And what I would love is that we've got a number of questions coming through, and if there's anything relevant to you, I will also bring you into the conversation again.
All
But
right.
thank you so much for sharing that part of your journey. Really, really privileged
You're
to hear
welcome.
you. Thank you. Um, Dr. Mbema, I'll be looping you in as well, just with some of the questions too. So I think one of the things is that I've had a number of people who typically, I'm sure, either feeling whilst you were talking or have felt something previously. And as you were talking, it's come to their mind. And someone's described this, and I just wanted for you to just respond as a kind of a call to action, as it were. So someone said that they have a small breast, and it feels very firm. And when she's touching them, she can touch right down to her rib cage or muscle. And so when finding this hard spot, it's hard to differ from a lump. So she's got a small breast, so it's easy to feel her rib cage underneath. And she thinks it's a rib cage or muscle, but she's not quite sure. And she's finding it difficult to distinguish whether it's hardness because of the rib or if it's a lump, and just has written help. So just wanted to get your comments about that.
So,
Yeah.
so I think first, there are two things now. So have you always felt this structure, like this bony feel? One. Secondly is a lump will just feel very different. It's not the same as your rib cage bone or something. It will feel different. It will feel very abnormal.
Mm-hmm.
It may be small, abnormal, different. Now, if you have not been, so like I said, how long have you been feeling it? Has it always been like that? So if it has always been like that, probably it is not. But having said that, I don't think it is out of place for you to also go and check. Just get somebody to check for you. Like go to the hospital and just check. It won't hurt you.
Thank you so much. I think I can see, Dr. Mbema, you're nodding, so you're
Yeah.
agreeing with that. Yeah,
Yeah, I would echo that if you're not sure, check it out, I would say, because you just wouldn't want to not have it checked out and continue in that uncertainty. And I know that there's, waiting times for GPs and all of that, but I would err on the side of caution, particularly because we know, as I've shown all that data, that we are at higher risk of being diagnosed at a later stage. I would say if you're not sure, book an appointment with your GP, just explain that I felt this, it feels unusual for me, I just wanted to get your view on it. And I think that's totally fine. Yeah.
great. And Dr. Mbema, there's also the sense of, what does a breast lump feel like? And is it similar to hernia lump? Is it hard or soft? Someone's put, does it re-swell after putting pressure on it? So I don't know if you can just offer some of insights into that for people.
Yeah, I mean, that's a difficult one for me to answer, being
Yeah.
sort of public health, and I'm not a breast surgeon or oncologist. So again, my main message is, if you're not sure, as Adil's mentioned, if it's unusual for you, you feel it's strange, it's something that's come out of the blue, go and check it out with the GP, because I would say from the materials that I've read, there are other causes of breast lumps, but what you're trying to do is you're trying to decipher, and you as non-clinician, you may not be able to determine whether it is a cyst or whether it is breast cancer, whether it's something that's usual or not. So I would say if you're feeling it's unusual for you, go and get it checked out. Don't try and do the diagnosis yourself by saying, oh, it's this and this and I've diagnosed it myself. No, if it's a lump, it's come out of the blue, it's unusual, you're not quite sure what it is, seek advice from your GP.
Great, thank you. And also, there's a question as well, is that, you completely relate to this, is it normal to feel a little uncomfortable while doing it at home, doing the touch test at home? It's almost like you don't want to touch it. So just if you could give reflections on that.
Yeah, I mean, I understand the discomfort or it being unusual. If you've not checked your breast before yourself, it will be unusual. It will be something new to you. But I would just encourage you to give it a go, first of all. When we're saying, feel with your hand, don't put loads of pressure on yourself. You do some gentle movements, vary your pressure, don't hurt yourself. But what you're trying to do is just understand what's usual for you. So I think that's the baseline, what's usual for you, because then it makes it so much easier to know when something's out of the blue, unusual. So because I've got into the practice of doing that, I feel that if I see something unusual or if I felt it, I would know by now, because at least a month I would have I know what they look like, I know how they feel like usually during my period or not. And so it just makes it that much easier for me then to know when something's unusual or different. So I was just giving it a go. Be gentle with yourself, don't hurt yourself, but just give it a go. Number one, even looking. If you've never even looked at your breasts before to understand what they look like, do that first of all as a first point, and then a light feel, and also include the armpit as I've mentioned, just to get a sense. And then from then onwards, when you're doing your monthly checks, you will then be able to know what is not normal for you. I hope that's clear.
No, that's great. Thank you. And another question is, so why does breast cancer mortality seem higher for Black women, even with the same diagnosis stage?
Yes, so I think that is, as I mentioned, if you're detected at a later, if you're a higher risk, as an ethnic group, a high risk of being diagnosed at that later stage, it does mean that if at stage 3 or 4, cancer is more likely to have be larger or spread elsewhere. As I mentioned, the survival rates will therefore be low, unfortunately, because of the stage of diagnosis. So, because we know that, we've got this knowledge now that that is the case, we can try to put steps in place to make sure that we're picking that up as early as possible. So hence me stressing on, I'm going to repeat myself again, but the checking, and then if you are invited for that screening, to please go for that screening so that we can do our best to change that story, really, so that we are picking things up as early as possible.
Great, thank you. And I thought this question would come up. In the news, we've been hearing about kind of targeted immune treatments for cancer. And I think someone's just asked if there's any updates or information that you know of about it. May or may not be the case.
Yeah, so unfortunately, as I mentioned, because I'm more the public health side, I'm not, so up to date with all the treatments. But what I've discussed with colleagues at Khan is that we do a part 2 of this. So I've talked about the overview, prevention, early intervention, but maybe the next time, and we're thinking about maybe doing it during Breast Cancer Awareness Month, we talk much more about the diagnosis, treatment, that side of things, with an oncologist or a cancer specialist coming to talk to you more about the different options for diagnosis, what the different treatments are, because unfortunately beyond my expertise, but I think it'll be really lovely to do that, because I know that there'll be lots of interest and questions about that.
No, definitely. And I think the only thing I would mention about it is that it's the promise it shows is that there are some cancers that we've got really good therapies for, and we see really good outcomes. But unfortunately, there are some that do not respond as well to the current therapies. So what we're seeing with the immune therapies is that it's kind of opening the door to other therapies which seem to be able to treat those ones that are not responding well to existing therapies. I know one of my colleagues has been involved in some of the research, so I could never give it justice. But I think it's exciting that the research is out there and ongoing. So we look forward to talking about it more. I think the session is going to be, as you say, in October for Cancer Awareness Month. So that will be great. Another question for you. I'm mindful of time, but I'm sure you probably get asked this a lot, is will the age of screening be lowered, as you said that we do see it in younger women?
Yes, so again, I can't speak on behalf of the National Breast Cancer Screening Program, but what I will say from my public health knowledge is that when we put a screening program in place, there are a number of criteria that have to be fulfilled for the screening to be cost effective. So that is things about the disease itself, the age groups at risk, what we call the pathogenesis, so the disease journey, etc., so that it is a disease where you can pick up something earlier than you would have otherwise, and treating it at that earlier stage has significant benefits. So certainly that's the case for breast cancer. And the age group, the 50 to 71, is based on research where we know there is the highest risk of people getting breast cancer. Whether that will change because of any change in the population will have to be determined by the National Cancer Screening Program. But that is how we make that determination, basically based on the research, based on who the disease most affects, based on when you intervene, whether you can prevent something further down the line. Those are the types of criteria that we look at. And so nationally, they'll be looking at these things all the time. They'll be looking at all these charts that I'm showing you. They'll be looking at that just to understand, do we need to change things? Do we need to have a review? So as I said, probably national colleagues are doing that. I have not been given any information that suggests that screening age will change at the moment. But I think if the evidence would suggest that there'll be benefit from doing that, national colleagues may bring that into their considerations.
Great. And as a last kind of joint question, there's a couple of questions I'm just going to merge. So it is about the actual mammogram. So two parts to it. So someone's described, and I hear this a lot, about finding it embarrassing of the way the screening is done with the mammogram and the kind of clapping with it, and just saying, isn't there going to be another way of screening? And then joined in with that is that someone's commented, made it quite a few in privately as well, have said that they recognize that Black women are more likely to have dense breasts, so sometimes lumps aren't detected as easily, and then they found the process of the mammogram, they found it quite difficult. So they're just wondering if there is any work being done for other screening tests in the future.
I think that's a really helpful question. Now, I am aware of research being done into the how people find the screening process. So, how comfortable do people, because we've seen that drop in screening, there's a lot of interest in what we can do to support women to take up the offer. So I know there's definitely research being done there. Just to see, how people are finding it. So this is important information that you're sharing today, that it's people might find it comfortable, the density of breast may be an impact, etc. Because again, that's all data that screening colleagues, those who design the program, can use to make sure that it's an experience that people will come forward for. The last thing we want is that people are not attending for things that we may be able to do something about and change. So in terms of beyond the mammography that we do at the moment, again, I'm not aware of anything that's coming down the pipeline. That's not to say that it isn't. It could be my knowledge. I'm working at a local level. There are other colleagues working nationally. But I'm definitely aware of research happening into mammography and the experience for women, because we've seen that decline and we really want to see that recover.
That's great to hear. Thank you so much. Another great session as always. Dr. Catherine, thank you so much. And we are so looking forward to having you and other colleagues here in October to have part 2, as it were. So thank you. And Adiola, just a huge thank you for sharing your experience. And I've had people come message me privately just saying it's just so refreshing to see someone just talk about their journey. So we're hugely appreciative. And I always say this before I hand over to colleagues at Khan, thank you to everyone that interacts with their questions, because you really make the show and really home in on what we need to learn more together. So thank you all. Really appreciate it. And now over to Leona, who's just going to give us some announcements as we close today. So thank you again to Dr. Mbema and to Adiola.
You're welcome.
Hello, everyone. Hello.
Hello. Yeah.
Hello.
Yeah, please, can you see my screen?
Yes, we can.
Yes.
Okay. On behalf of Khan, I would like to thank a massive thank you to Dr. Mbema for that insightful presentation. And to you, Dr. Vanessa, thank you very much for that brilliant facilitation. And thank you so much, Adiola, for gathering the courage to share your lived experiences with us and for highlighting the need to regularly check our breast in order to find in order to spot out unusual lumps in our breast, and then getting treatment as early as possible. Thank you so much. And before we bring down the curtains on today's health, there are some upcoming programs I would like to shed light on. So Health Hour will return next week to us using the same link at the same time. And our topic for next week will be the importance of blood donation and how that helps to save lives. And this will be handled by our abled guest speaker, Dr. Ineka Anebu. Following the inaugural meeting of the all-party parliamentary group, it's been revealed that there's a gap in terms of research surrounding fibroids. So, Khan has taken up the responsibility to call for evidence, and we can't do this all alone. So, we are encouraging everybody on the line today, in case you've been impacted by fibroids, or you know someone, a family, friend, or relative who has been impacted negatively by fibroids, kindly scan our QR code, share with your contacts on your phone in order to get that massive response to be able to influence policy and practice. Okay, our annual Windrush celebration day will be coming off on the 21st of June, 2025, within the hours of 12 to 6 at the Alexandra Park. There'll be different meals that we can all share together and dance to different tunes of music. I'm reminding everyone that it's a free entry program for people of all ages. So don't come alone, come with family and friends. If you are interested, kindly scan the QR code you see on my screen to book your attendance. Okay, so if you are a business owner or an organization who is interested in showcasing your products or services on that day, we have limited spaces in terms of stalls. So kindly scan the QR code as you book your stall today. On the 12th of July, we'll be coming your way with our Black Healthcare Awards, which will be happening at the Park Plaza, Westminster Bridge, London. For your tickets, kindly scan the QR code you see on my screen in order to secure your ticket. Have you recently lost a loved one, or do you have any unresolved griefs? Khan is supporting you with a free online bereavement section, and our first session will be on Monday, that's the 2nd of June. So in case you are in that space, kindly scan our QR code to register or kindly send a mail to roslyn@can.org.uk. And the final one is about the Windrush compensation scheme. So CAN has partnered with the Home Office, a speaker from the Home Office, to share on the Windrush compensation scheme. So if you know someone who has been impacted by the Windrush, kindly spread the news and make a difference in someone's life. Join us on the 7th of June as we share light on how to navigate the process smoothly, and then check on how to check your eligibility criteria to be able to benefit from this. Thank you all for joining us today, and we look forward to seeing all of you next week. Bye.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions, spread the word in our community.